for the second type of our experimental design, we have the quasi-experimental design. So the quasi-experimental design class, the researchers initiates an experimental treatment, but it lacks one characteristic. So remember, a while ago, for true experimental design, it has three characteristics: the control, the randomization, and the manipulation. So what is lacking in our quasi-experimental design is it has no randomization. Okay? It lacks the characteristic of true experiment of randomization. So under quasi-experimental design, we have two types: the non-equivalent control group design and the time series design. So for the non-equivalent control group design, this is also known as the no randomization quasi design. So also known as non-equivalent control group design, identical to the pre-test and post-test control group design, but there's no randomization of subject in experimental and control group. In other words, you can assign who will belong in the experimental and who will belong in the control group. There would be the essence or the element of bias, in other words. The second type of quasi-experimental is the time series design. So this one lacks both randomization and lacks control group. So it is useful when researcher wants to measure the effects of the treatment over a long period of time. It may seem to be less scientific compared to true experimental, but quasi-experimental design, such as time series design, will allow the real condition in the population to be experienced in the certain group and allows the data to be expressed in the real setting, because in the real scenario there is no randomization. In the real scenario there is no control group. So in other words, quasi time series design is the best, or is reliable also, to express what is the effect of drug in certain population over a long period of time. So we have here experimental group. We have O1, O2, O3. This is our observation, the first observation, the second observation, and the third observation. So as the name it implies, time series, there is segments of observation before the treatment. So we will give the treatment and observe also in time series, observation 1, 2, and 3. So an example for this is if we want to analyze the effect of patient compliance, or we want to analyze the blood pressure of elderly. So we have our experimental group, the elderly with hypertension. We are going to observe their blood pressure levels in 3 segments. For example, every week, observation 1, week 1, week 2, and week 3. After that one, without any treatment, we will introduce treatment in week 4. And then we are going to continue the treatment, and we will observe for another weekly basis for the next 3 weeks. And we are going to observe the effect now, or generalize now, the blood pressure of the elderly if our treatment is giving an optimum effect in the population of choice. Okay, so this can be applied to in your research topic of interest.